Today's topic, chewing gum. So let's get into it. What's up everyone, Dr. Eric Jackson here. Thought I would jump in today and talk about a fairly common question I get both from patients in my office as well as from community members when I go around and speak. It's, does chewing gum really help fight cavities? And the short answer is yes. But that's not what we're gonna stop the video, obviously. Let's talk about why. First things, not all gum is the same, right? You've got to chew sugarless gum or sugar-free gum because otherwise it's going to cause a problem. Chewing sugar-free gum for 20 minutes does actually help decrease cavity rates. Why is that? Well, the number one reason why is increased salivary flow because the saliva has a multifaceted protective approach, right? It lubricates the mouth, helps to wash away food and the debris from on the teeth, in the grooves, around the teeth, in the flossing areas, in between the teeth. It also helps to pH balance the mouth. It neutralizes the acids caused by the bacteria. It provides disease-fighting substances throughout the whole mouth. It also ultimately adds a little bit extra nutrients. It adds calcium and phosphate, which helps strengthen the tooth enamel and helps remineralize, especially when you're eating acidic foods. That's in the phase after the actual food is being eaten. But like I said before, not every single piece of gum is the same. It's got to be sugar-free, and I always recommend trust the researchers at the American Dental Association. Reach for the gum that has the ADA seal of acceptance. For those of you that aren't familiar, the ADA seal of acceptance is first of all, a great way to identify a quality dental product that does what it says. The ADA researchers, it's a tremendous process actually. The ADA researchers look into these products, they study them, they test them, and they make sure that the validity is there because now more than ever, in this day and age, you can get dental aids for the internet, you can do it all sorts of different ways. But do they actually work? And on top of that, I will add, are they harmful? Do you know what's in them? That's a whole different video, a whole different discussion, other ways. But the best way to protect yourself and to know that you're spending your time, effort, and money correctly is to choose an ADA accepted product that has the ADA seal of acceptance on it. So anyways, back to sugar-free gum with the ADA seal of acceptance. Anything that's got the ADA seal of acceptance is sweetened by non-cavity causing sweeteners, aspartame, xylitol, sorbitol, mannitol. These guys are all artificial sweeteners that will not provide the natural sugar that bacteria typically thrive on. Now, don't get me wrong, chewing sugar-free gum for 20 minutes is great, but it doesn't replace normal oral hygiene. 2 minutes, 2 times a day. The classic brushing recommendation is the gold standard. Flossing once a day, gold standard. Got to do your job in the brushing and flossing department. I would also like to add, consider your rinsing. Consider your rinsing with a Listerine type product, a Crest, a Scope, lots of different types of rinses in there too. I'm a big believer in floss, brush, rinse as a 3-step process. In the event that you can't reach for your brush or you don't have those 3 items, a piece of sugar-free gum is a nice alternative. It's certainly better than nothing. And at the very least, if you're a gum chewer, definitely consider it as your staple gum of choice. So as long as you keep everything in perspective, you select the ADA seal of acceptance gum, the sugar-free gum, you don't use it as your main method of oral hygiene. You got to still brush and floss and rinse. And I will throw in there, don't go overboard with your gum. There's always potential for exacerbating some temporomandibular joint issues. So everything in moderation is, you'll hear this come out of my mouth on so many different videos here, and I think this applies as well. Go ahead and chew your gum, select the right one, but don't chew nonstop all day long. Your jaw joint will not care for that very much eventually. As always, thank you for watching. I appreciate all the viewership. Please like the video if you did like it. Go ahead and subscribe to the channel. We'd love to have that happen. When you do so, make sure you click the bell and select all, so that way you'll get all the notifications of every video that's posted live right to your phone. Of course, if you have any questions or comments, I'd love to hear from you about them. Go ahead and post them below, and I'll see about answering them as soon as I can. Till then, take care of yourself, and I'll see you in the next video. Bye-bye now.